Mercy Health Physician Partners have received a total of 29,345. That is, that's the number that they've received directly, but then the number that Muskegon County Public Health receives, we also redistribute the majority of our doses to Mercy Health for administration and vaccination. So total overall 52,715. We have received one shipment of Johnson & Johnson of 1,500, and Public Health redistributed those, a good portion of those to Mercy Health, some to the federally qualified health centers. Next slide, please. Again, this is a chart of the number of doses administered per day to Muskegon County residents. And as you see, even though we received 54,000 directly, 58,123 doses have been administered to Muskegon County residents as of yesterday, late yesterday. You can see the number per day. So we have reached a peak of administering 2,691 doses within a day. And it looks like on 3/7, the lowest number was 25, but that was a Sunday, and that's normally not a normal vaccination day. Next slide. This graph actually shows the number of doses administered by age group, and the purple line again is the age group 65 and over. You see at the very beginning when doses was shipped to Muskegon County, it was intended for healthcare workers, and that is where most of those doses went. By the middle of January, we shift the focus, and most of those healthcare workers eligible had elected and been vaccinated. We shift the focus to focus on age 65 plus, with special emphasis on 85 plus, 75 plus, and as well as 65 plus. You can see within the last week that green line has shifted age 45 to 64. And these, again, are deliberate attempts to reach age groups, eligible individuals, age group 50 to 64, as we continue to focus on residents 85 plus, 75 plus, 65 plus. Next. This is a better depiction of the percentage of Muskegon County residents that have received at least one vaccination. So the age group 75 plus, 69% of that group. And that is based on the 2018 census, but 69% of the 12,175 individuals on the system have received at least one dose. 45% have received at least full vaccination, 2 doses, or if it's Johnson & Johnson, 1 dose. Remember that the individuals included in that 45% is also included in that initial dose as well. But we are making amazing progress here in Muskegon County, age 75 plus, age 65 plus, and we see, we will continue to focus on these age groups and as we prioritize individuals by age, because that is our most critical, most vulnerable need. Next. So here is our, this is the Mdhhs vaccination timeline. And here in Muskegon County, we work with all of our partners in the community, Mercy Health as the primary partner, but also our federally qualified health centers, our local pharmacies, and we discuss every week, and I can say truthfully 3 times a week, our vaccination distribution plan for Muskegon County residents. This is the month of March. If you see, based on this chart, we are simultaneously continuing to vaccinate individuals who fit within these categories with the check marks. Um, it's we look at the plan, we look at the number of doses we have, and most of the time we allocate a percentage of those doses to assure that we can at least touch individuals within that age, with eligible individuals within these phases. I can tell you that, we're not going to hit everybody at one time. We are doing small portions as the vaccine allow, and we are still continuing to vaccinate and prioritize individuals by age. But also, if you look at the phase 1A and some of the phase 1B, as those employees, healthcare employees, or long-term care residents, as that change, we also prioritize them and get them in for a vaccine as soon as we can. So again, we are vaccinating simultaneously with priority still focused on age, but we are still vaccinating those who are eligible in small portions. Next. I just threw this slide in here because I know this is a vaccination presentation, but I did not want to let this opportunity pass to just say how great we are doing with our actual number of COVID cases in Muskegon County. We have experienced a positivity rate of less than 3% for 16 or today 17 days in a row. Our hospital capacity, as Gary referenced, is awesome, absolutely great. And we have had 0 outbreaks in the month of March, and we've had 0 COVID-related deaths in the month of March, and also 0 deaths the last 2 weeks of February. So we are just amazingly in a good position here in Muskegon County as it relates to COVID-19 positive cases as well. And my final slide. I know they're going to elaborate a little bit more on this, but just to say that, we have so many community partners in Muskegon County that is working with both public health and our hospital system and our federally qualified health systems to make sure that we reach individuals all throughout Muskegon County. So those that meet the definition of social vulnerability, we're also reaching out to rural populations. We're working with grassroots organizations, and those numbers that I showed, those successful numbers as far as COVID cases and vaccinations, we could not have done this without this large partnership, very indicative of Muskegon County even before COVID-19. So that concludes my report. Now I'd like to introduce Cece Riley, the Communications and Training Manager of Health West. She will discuss the collaborative efforts around vaccine distribution and how people can register for a vaccine. Cece.
Thanks, Kathy. Happy to be here. Hi, everyone. Kathy touched on it quite a bit, but it's really a theme here in Muskegon County, our collaborative nature and how we kind of rally together in instances like fighting COVID-19. And so I'm here representing the Mask Up Muskegon campaign and collaborative effort. And what really happened is when our community was impacted by COVID, now a year ago, last March and April, a big group of people came together and really wanted to work collaboratively to help keep local residents informed and up to date on changes that were happening with COVID. And so starting last April, we really launched, it didn't have this name quite yet, but it was the Mask Up Muskegon campaign. And we had 100+ local businesses and organizations come together and agree to help keep the residents of this community informed of the changes that were happening. In November, we decided to launch a website, which is maskupmuskegon.org, and all of the partners kind of rallied around this site as a central hub of information for anything related to COVID. And so this partnership work really set us up well when we were notified that we would be receiving vaccines in the community, and we already had the central hub of information built. And so it was a natural segue to also use that mascotmuskegon.org site as our central vaccine information hub. Also on that website, in addition to vaccine information, you can find local testing information on how to access local free fabric masks that are available to the community at large. We reiterate state and local guidelines related to mask usage, some of the social gathering restrictions, et cetera. We really wanted a place where we could speak directly to the residents of this county. And so that's why that site was built. And there's a lot of really great information on there. There's also graphics that individuals across the community can download and help share. Some of the stats that Kathy spoke of today, we reiterate those and build social media graphics that the community can help get the word out, and kind of help us tell the community where we're at and how these processes are working. As I mentioned, when we were notified of that the county would be receiving vaccines, all of the partners came very quickly together, and we had this infrastructure already built. We have heard from other communities and other stakeholders across the state of Michigan that the collaborative work of Muskegon County is pretty unique. And there aren't a lot of communities that are really coming together in the way that we are to ensure that we can roll out vaccines to the county as quickly as what we're doing. And so this partnership allowed us to all come together, and we said, okay, who has vaccines? How are we going to distribute them? And it's really actually made it so that we have sped up that vaccine rollout for residents of this county, as well as help eliminate confusion on the registration process, where to go for information, how to get testing. Those were all things that were really important to us in keeping the county's residents informed. On the Mascot Muskegon website, there is a registration link to add your email information so that we can help communicate with the community at large as things change. For those of us who have been working in the vaccine rollout world, things change very, very quickly. And so having that central list to be able to keep the community informed is really important to us. We currently have about 12,000 people who receive typically weekly updates on where we're at with vaccine rollout across the county, and any new information that's coming with changes in priority groups, changes in registration process, et cetera. And so I think it's important for the community to know about that resource and that they can tap into that information as well. Today at the mascotmuskegon.org website, we house the central link for the county's central registry system for individuals age 65 and older to register for a COVID vaccine. Kathy has made a public statement that it is our goal as Muskegon County to schedule every individual who is registered that is age 65 and older for a vaccine by the end of this month. And we are well on our way to meeting that goal. Additionally, last week, we made another announcement that individuals age 75 and older would be prioritized for quick vaccination. And so as new individuals who are over the age of 75 or 75 and older are registering for vaccination, they are quickly being called, typically within 24 hours, and offered an appointment for vaccination. Next week, our hope is to move that to individuals age 70 and older. To be prioritized for quick vaccination. We have additionally partnered with 211, who is helping register individuals for vaccination. So anybody over the age of 65 can visit mascotmuskegon.org to register, or they can call 211. And they have trained staff locally who are helping individuals register on that site, and they will actually do all the work for you. And so we have seen, since we have spread this message and through this collaborative, we've been able to keep all of our partners informed and also help get the word out there, that we are really working to identify the remaining individuals who are over the age of 65 and specifically 75 in this community that want vaccination, and make sure that we're able to locate them and offer them that vaccine if they so desire to receive it. There are a number of Kathy touched on this a little bit, but I think it's important for the county to really understand that there are a number of partners that are receiving vaccine and working together on that effort. As you saw in those previous slides, that Mercy Health, Muskegon, and the Health Department, Public Health, are two of the largest recipients of vaccines here in Muskegon County. And Tom will be speaking a little bit more about how Mercy is, where they're vaccinating and how they're doing the vaccinations through Mercy Health. But on the public health side, Health West operates a specialty clinic on behalf of public health, and we're currently at vaccinating individuals age 75 and older in that clinic, as well as some other specialty populations. And then public health also does a series of mobile clinics throughout the county where we're able to really meet people where they are at. That's one of the ways that we've been able to vaccinate educators across the county, as well as members that are individual residents that fall within that social vulnerability index that the state has put forward. Other vaccine distribution partners include Meyer. They are another very large vaccine partner in this county, and they are also working collaboratively with the Mascot Muskegon campaign, and we're able to partner with Meyer and the rest of these partners to be able to know who is being vaccinated so that we can help remove them from that central registry system and eliminate the number of calls that we're making to people who have already been vaccinated. So that partnership has been going very well. Also, Kathy touched on the federally qualified health centers. Both Muskegon Family Care and Happily Community Care are offering vaccines locally at their clinics. And there's a number of other retail pharmacies that are slowly coming on board and offering vaccines in small numbers at this time, but our hope is that those will increase over time. And then also the Veterans Administration has started recently receiving vaccines and offering them to local veterans. And they're actually holding a clinic next Wednesday, the 17th, from 10 to 3 p.m. at the USS Silverside Museum. And that's open for any local veteran, a walk-in clinic for vaccination until supplies run out. That really is the highlight of our overall collaborative efforts. And I know Stevie will touch on it a little bit more. At this time, I would like to turn the discussion over to Dr. Tom Foster. He's the Chief Medical Officer for Mercy Health Physician Partners, and he will be discussing Mercy Health's current and planned vaccination sites and operations in the Muskegon County.
Thank you, Cece. I'm Dr. Tom Foster, Chief Medical Officer, as she mentioned, of Mercy Health Physician Partners. We work very closely with public health and then also the hospital. And we initially started our immunizations in the hospital as for storage issues in regards to immunizations, but have moved out and now using Hackley urgent care and working with public health also in that population around in that community to get all those patients in, and plus our own MHPP patients. We also have another site, Shape Corporations has partnered with us to utilize their training areas where they normally would have people coming in to train. They can't do that anymore. So it's a great site for us to get down into Southern Muskegon County and also exposure to North Ottawa and our patients down there, but also our Muskegon community as well. We have the ability to see up to 800 patients a day at that site. In fact, yesterday, the last few days, we've been over 600. So Shape is down, and basically on Taft Street near Spring Lake. And it's been pretty exciting to partner with a community team that in private company that just is willing to step forward for the community. So that's been an excellent partnership. We are using all vaccines. We have J&J, Moderna, and Pfizer. We feel that they're all efficacious. And if they have any vaccine that's available, it's a good vaccine right now. We feel very confident in all the vaccines, and they can deliver to decrease severity, decrease hospitalizations, and decrease death. And so that's what we need right now. And as the community needs, we need to get as many vaccine in arms. And that's kind of our goal right now. In the future, we may be looking at our Quarterline office over by Muskegon Community College. That may be another future site we'll take a look at to expose to more of the community and also our MHPP patients too. That's something that's being discussed, but we don't have any timelines for that right now. We have, as Kathy pointed out, all the vaccine numbers. We're very proud of that. And we will continue to strive to reach out to as much of the community as possible and support our public partners. With that, I want to pass it off now to Stevie Riles, who's going to, the Mercy Health Regional Director of Health and Wellness, and she's going to share about some of the outreach. It's been really great to our community.
Thank you, Dr. Foster. Good morning, everybody. To Dr. Foster's point, it really comes down to getting those vaccines in arms. And one of the ways that we're doing this to make sure we can not leave behind some of the more vulnerable, underserved residents in our community is really partnering with local safety net or community service providers who are really adept at working with some of these populations that can often be very difficult to connect with for a variety of reasons. Technology, transportation, maybe they're homeless. And so we have been really, really fortunate to successfully partner with a lot of different community organizations to host pop-up clinics with public health team. Health West has been doing a lot of that. But we've had several partners, United Way, Rotary, the NAACP, Latinos Working for the Future, Muskegon Young Black Professionals who have really stepped up and said, let us help you. And we don't turn down help when you come to our table. So we've been really fortunate to leverage the collective power of the work of those individuals and organizations who are so committed to this community. And one of the things that we really wanted to make sure was happening is that people had a really trusted source of information and access to either get information about the vaccine to make a decision or to actually go and get the vaccine. And we want to be really intentional about having these offerings in parts of the community that are safe and convenient, and in parts of the community where people are going to, be able to go safely without compromising the social distancing, recommendations and such. And so we're very excited about the work that's been happening. Every week we have a new partner come to the table, and Kathy has been incredible in her leadership in saying to us, if you can get the people to the table, I can get you the vials. I can't remember how you word it, Kathy, but if you get the people to the table, you get the vials to the arms, something to that effect. And it's been working really well. So as we're moving towards larger, broad community vaccination, it's going to get easier for us to vaccinate everybody. Kathy and Cece and others, spoke to the additional retail partners that are helping. That is only good news for us. I think really our focus is on making sure that as we're moving more firmly into broad prioritization categories and broad community vaccination, is making sure we didn't leave anybody behind, which is why we're really focusing on making sure our residents that are 75 years and older, we get them, all set, because they have been, eligible for a while, and kind of moving through the age groups that way. So we welcome collaboration if there are people who say, they want us to help them help their community, help them help their patients. We are very, very open to that. The other thing that we wanted to make sure is that we had really culturally sensitive people who are working the scheduling. So Kathy has organized a team of community-based people, including community health workers and others who are, kind of in that customer service mindset, so that when people call, they can get the information they want, and we can make sure they have access to transportation to get to their vaccine appointment, or we can kind of talk through some of the barriers that might be in place. So it's been a really good system. We're really fortunate for all of the partners in this community. And as we continue to vaccinate people, we are going to really depend on you all to help us get that word out, because if people want to be vaccinated, we will vaccinate them. So with that, I am going to hand it back to Gary Allure, and I think we'll be ready to answer some questions.
Thanks, Stevie. Great job. So yeah, we are looking in the chat function, and we don't see any questions there right now. Hope that's an indication that we provided some decent information. But I guess we could open it up if anybody has any questions they would like to ask. I'll give that opportunity. Take yourself off mute if you would like to ask. Well, while you're thinking about that, all I can say is you can see just in the conversation the last 20 minutes, we have an amazing partnership in Muskegon, and Mercy Health is so proud to work with all of the parties we're talking to. It's very clear, and I think you guys will see this as the doses start to increase and we get more in this community. We are prepared to get them out. We got ways to continue to expand, and we're going to get this community vaccinated. So it's exciting to work together through this, and I think it says a lot about partnership in Muskegon and these partnerships. So I just want to thank everyone for joining us this morning. And if there are no other questions, I think we will complete this press conference.
Thanks, Gary. Yeah, so thank you, everyone. Thank you to the media. If there are any follow-up questions later from the media, you can certainly reach to me. and I can track down the right person from today's participants, and we can get those answered for you. But with that, again, thank everyone for joining us, and have a good day.
Thank you.